Yes, thank you. So good morning, ladies and gentlemen. Welcome to today's webinar on the COVID-19 and the Youth Question in Africa project. We are delighted to have you join us for this insightful session that focuses on youth empowerment and resilience in the face of COVID-19. We'll explore the impact of COVID-19 on health, governance, education, and social protection. The COYOQA project, as you know, is being implemented in 3 countries, Ethiopia, Kenya, and Uganda, with the aim of understanding and addressing the impacts of COVID-19 on youth empowerment. Today, we have the privilege of hearing from 3 young voices who have been working as monitoring, evaluation, and learning coordinators for the project in the 3 countries. They will be sharing their reflections on 3 crucial topics. Firstly, we have Fasika Getu from Ethiopia, who will discuss navigating COVID-19, understanding the health and governance impacts on youth empowerment in Ethiopia. Fasika will shed light on the unique challenges faced by Ethiopian youth and explore the influence of COVID-19 on health and governance factors on youth empowerment. Next, we'll hear from Dr. Jerome Ntege, who will address navigating education in crisis, COVID-19's impact on youth education in Uganda. Dr. Jerome will share valuable insights into the specific education challenges faced by Ugandan youth and examine the consequences of the pandemic on their educational journey. Lastly, we have Beth Maloba, who will present on examining the influence of social protection on youth empowerment amidst the COVID-19 pandemic. Beth will delve into the role of social protection measures in empowering young people during these challenging times. Following the presentations, we'll have a dedicated session for questions and answers, which will be moderated by Malcolm Srabara, another passionate youth from the consortium of Christian Relief Development Association in Ethiopia. But before we proceed, I would like to invite Dr. Trufena Mukuna, the Executive Director of Austria and the Principal Investigator of the COYOQA project, to say a few words. Dr. Mukuna has been instrumental in guiding and supporting this project, and her insights will provide valuable context for our discussions today. Once again, we appreciate your presence and participation in this webinar. Let's now begin with the presentations, starting with Dr. Trufena Mukuna's opening remarks. Thank you. Over to you, Dr. Trufena.
Good morning, everyone. Because we have a problem with the internet in Ethiopia, allow me not to use the video. Most of you know me, and I'm happy to have all of you here to talk about these issues on social accountability and how the youth were meaningfully engaged in holding the government accountable. This is a project that started in 2020. We are in the last 6 months of the project, and we have already covered a lot of ground as far as our objectives are concerned. Right now, we are just sharing some of the findings from our research in preparation to the international conference that will be coming up sometime in August. Right now, I don't want to go so much into, I don't want to dilute the good presentations that we are awaiting to listen to, but I would like to just share with you the idea that engaging youth meaningfully in social accountability is very important. They have great potential, and they have shown us in the 3 selected countries where we worked, and even in the 9 research sites where we worked, the youth have great potential, and they are for sure holding their governments accountable. This is just about the promises that the government made to the people during COVID-19, and the youth have followed up. They followed up these promises that the government made, and in their process of following up, doing monitoring and evaluation, we have found very interesting outcomes from it. So with that, I welcome all of you to these presentations.
Thank you, Dr. Sfena. For the sake of time, I will just go to the first presenter, who will be Beth Maloba. She is from Kenya. She's the monitoring and evaluation and learning coordinator of the project in Kenya. Over to you, Beth.
Good morning.
Can you put your presentations up?
Yes. Good morning. My name is Beth Amanda Maloba. I am the Monitoring, Evaluation and Learning Coordinator, Kenya, for the COYOQA project, and today I'm presenting on the impact of social protection on the youth during COVID-19. My presentation I will introduce social protection, talk about the impact. I will overview the initiatives that the social protection initiatives in Kenya and other social protection measures. I'll talk about the findings and policy implications and recommendations, and lastly, I'll conclude. Social protection is a set of policies and programs designed to support individuals and communities in time of need during such as economic downturns, natural disasters, or health crises, like when we had COVID-19. It involves providing financial assistance, access to health services, and social support to vulnerable populations. It is important during crisis because it ensures economic stability, poverty reduction, health and well-being, food security, and social cohesion. During COVID-19, the youth in Kenya had very significant, they were affected significantly by the pandemic because the education was disrupted because of school closure. The rate of youth unemployment went up because a lot of the youth were laid off work. There was economic challenges because most businesses were closed. Due to the closure and the quarantine, there were a lot of mental health struggles. There were a lot of health risks. The rate of SGBV went up, and the medication, the essential medication for other diseases were not readily available, and also people were afraid to access hospital because of the pandemic. And there are other social implications, like there were changes in family roles. There were a lot of people could not connect with their friends, and it's brought a lot of issues. And during that time, the government came up with several social protection initiatives. There were social protection initiatives before the pandemic, and there are those that were initiated during the pandemic, but today we are focusing on the ones that came in during the pandemic. There are cash transfer programs, which were meant to provide immediate financial support to vulnerable households affected by the pandemic, alleviate poverty, and prevent the sharp decline in living standards, enhance household purchasing power, and enable them to meet their basic needs. Inua Jamii program, which provided social assistance to the elderly persons aged 70 and above, improved well-being and livelihoods for elderly individuals, and enhanced social protection for the aging population. Hunger Safety Net program, which addressed the food insecurity among vulnerable households in the arid and semi-arid regions. They were providing cash transfers and additional support to enhance food access. The National Safety Net program, which was integrated in various social protection initiatives into a cohesive program. It assisted, it targeted to assist the most vulnerable individuals and households. Health insurance subsidy. In Kenya, there's National Health Insurance, NHIF fund, which vulnerable populations were being given at a lower subsidized price. And during COVID, they ensured that these people can access healthcare services using their NHIF cards. There was the Kazi Mtaani initiative, which was one of the biggest initiatives that happened during COVID-19, which provided temporary employment opportunities to the vulnerable youth affected by the pandemic. The Kazi Mtaani initiative also helped to reduce the crime in the communities because now the youth were engaged. There was also school feeding programs which came in when the schools opened up, like the Cup of Uji, where the youth were going to schools and providing the children with food. In addition to the social protection initiatives, the government implemented several other measures to support citizens, and most of these measures were not project-based, but they aimed to provide general relief and assistance, and some of them were the tax relief measures, where tax were cut, there were waivers and extensions on filing tax returns, providing economic relief to taxpayers. There was the economic stimulus package by the government, which included funding for businesses, job creation programs, and support to key industries such as agriculture, manufacturing, and tourism. The loan moratoriums allowed individuals and businesses to temporarily suspend loan repayments and restructure their loan terms. Eviction moratoriums, which ensured housing security for citizens facing financial difficulties. So when it comes to this eviction moratorium, it depended on the different landlords and ladies. There were cuts in prices for certain commodities in the markets. There was health infrastructure investment. The government really invested in building more wards and buying more oxygen tanks and those kinds of things that were very essential during the COVID-19. And also the government invested fully in campaigns, public awareness campaigns, to make sure that every Kenyan is aware of the pandemic and what to do and what not to do. When we look at the COYOQA project, we have done several we have talked to the youth, we have collected data, and from the data we have collected, we found out that for the Kazi Mtaani, which was the biggest targeting on the youth, there were about 900 informal settlements that were rehabilitated, and it provided a daily wage of 455 shillings to 505 shillings to about 283,000 local youth in 47 counties. From the data collected, we found out that not all the youth knew about the Kazi Mtaani initiative, and those that knew about it did not know how to be involved in it. Also, there was a lot of bureaucracy which led to discrimination for the youth in the regions that we collected the data, that is Busia, Mombasa, and Nairobi. One of the respondents in Kibra stated that the initiative was only accessible to the youth with IDs, and some youth even had 2 roles in the initiative, making it hard for other youth to participate. Even though the youth are aged between 18 and 35, during the pandemic, it was very hard to apply for national identification cards, and due to that, a lot of the youth were left out. It was also evident that the caste transfer program for the OVC and the physically impaired and the older people was not getting to the vulnerable families on time. Sometimes it would take up to 4 months before they get any relief. From the skits that were performed during the social accountability workshops, it was evident that the youth felt the government had discrimination, and the perception that the leaders had on the youth is one of the contributing factors to the discrimination. Because you're a youth and you're dressed a certain way, the leaders were looking at you and deciding not to give you the role. And due to this, there was also some form of feeling left out. Of course, Kenyans like joking, and during the pandemic, one of the things that really entertained the youth was memes. Like you can see here, it says mshahara kidogo na kazi mtaani inafanya uanze kuita potatoes ati poritos. Ukipata ya ofisi sasa itakuwa aje. This was just a way of making the youth be. We were joking about kazi mtaani. Even though the government came up with initiatives, the youth also came up with different initiatives. Like in Busia County, youth initiated a safe interactive space for playing football and discussing challenges faced during the pandemic. The initiative promoted mental health among the youth and helped prevent crime by providing a positive outlet for their energy. Discussions in the space also address sexual reproductive health, contributing to a reduction in teen pregnancies in the region. In Nairobi County, a youth-led initiative focused on ensuring food security for children who had returned to school after the pandemic-related closures. The initiatives began by providing a cup of uji. Uji is a nutritious porridge to children that has since expanded exponentially. Right now, it's all over Kenya. We see news about it, and it's a good initiative, one that the government and CSOs are most proud of right now. In Mombasa, a consortium of CSOs advocated for better treatment and safety measures for the community. This was followed after there was a massive stampede incident where many people were injured while trying to access the ferry. It worked to raise awareness and demand improved safety protocols and ensure the community. The policy implications and recommendations. The government and private sector need to enhance youth employment programs like Kazi Mtaani project to provide youth with internships, apprenticeships, and job placement programs. It is also essential to improve the access to quality education in Kenya by investing in technology and infrastructure to facilitate online learning and bridge the digital gap. The social protection initiatives need to be tailored to address the specific needs in different youth populations, because our needs are different as youth, and one initiative can't solve all of the issues that the youth are going through. The youth need to be engaged in the policy making and program development to ensure that their voices and perspectives are included in these initiatives. There's need to promote knowledge sharing platforms, like for COYOQA, we have the COYOQA community of practice and learning networks to facilitate collaboration and exchange of best practices. There's need to increase the coverage and reach of these programs to ensure that more vulnerable groups are included, and this will only be achieved through better targeting mechanisms and improved coordination between different government agencies. The government should also explore innovative financing mechanisms to ensure that the programs can continue to operate in the long term and provide support to those who need it most. There's also need to enhance the quality and effectiveness of the programs by providing a more comprehensive and integrated services such as healthcare, education, and skills training. Lastly, to increase the amount of cash transfer to the beneficiaries to ensure that they're able to meet basic needs and improve their economic status, like the cash transfer program that like the Inua Jamii. A lot of the older people and families that were depending on them really complained that the money was not enough for that time to even solve their basic needs. In conclusion, social protection programs in Kenya have played a vital role in mitigating the impacts of COVID-19 on the youth. They have provided essential economic, educational, and healthcare support to address the specific challenges faced by the vulnerable youth. However, to ensure a lasting impact, it is crucial to secure sustainable funding, strengthen targeting mechanisms, and implement continuous monitoring and evaluation. Social protection programs must be designed with a long-term perspective, taking into account the evolving needs and circumstances of the youth. The access to the program should be ensured for all youth, regardless of gender, ethnicity, or social economic background. However, moreover, investing in education and skills development can reduce reliance on social protection and open up opportunities for the youth. There's need for collaboration with the private sector for job creation and economic growth, which will facilitate the success of social protection initiatives. Through the efforts from all stakeholders, including government, CSOs, and the private sector, Kenya can pave a way for a brighter future where its youth are equipped with the necessary support and opportunities to thrive and contribute to the national progress. That is all for today. Thank you so much for listening. I will appreciate and answer to any questions that you have. Thank you.
Thank you, Beth. Thank you so much for a very excellent presentation and very insightful presentation. I'll now go to the second presenter, Pasika Getu from.
Good morning, everyone. My name is Pasika Getu. Pasika Getu Kabede. I am from Ethiopia, and I'm volunteering relation and learning coordinator for this COYOQA project. So today we will be seeing or navigating COVID-19 and the health and governance impact or understanding. My title is Understanding the Health and the government impacts of COVID-19 and on youth empowerment. So my outline or my presentation will be starting with an outline of introduction. We will have an introduction section, then an overview of health and governance impacts, the health impact, the governance impact, and the conclusion. So as we all know, the COVID-19 pandemic has been officially announced to have reached Africa in February 19 of 2022. So it took only 3 months for the infection or this COVID-19 pandemic to come across all the continent of Africa. So, like, although testing capacity was constrained, it appeared that communities transmission was occurring in the majority of Africa countries by May 26. So by the 6th of August, there were more than 1 million cases confirmed in this continent. And out of this 1 million confirmed cases, more than 80% of the cases were from the following countries, which were Egypt, Morocco, South Africa, Ethiopia, and Nigeria. They were taking 75% from this 1 million confirmed cases. So when we come to the youth, Africa makes up almost 19% of the world's young population, or the youth, with 226 million users are found in Africa. A 2015 report indicates that. So the number of young people in Africa expected to rise for 42% by 2030, which means like Africa has the most high population of youth. The urbanization rates in Africa is around 43.6%. Africans' urban homes are mostly characterized by poor access to drinkable water, poor access to facilities for washing, or they live in crowded areas. They're vulnerable to infections due to weak health system. Their prevalence of underlying diseases like HIV, AIDS, TB, malaria, malnutrition, as well as threats to state authority from armed groups. This is the characteristics of urban areas or urban African homes. So as a result, the rapid spread of the pandemic was expected to overburden health service. There was an expectation due to this high amount of urbanized places. The rapid spread of the pandemic was expected. So the government had addressed the COVID-19 pandemic by stating out lockdown, closure of school. It took different methods to stop this virus from spreading. So the major impact on health, because this pandemic or this health issue affects mostly, as the nature of the COVID-19 pandemic, it's a health issue. So the health sector or the health part of any country is the major sector that needs to be given attention because of the pandemic being a health issue. So from the health impact, the first impact was access to health. The pandemic has tremendous impact because Africa's health system are not adequately prepared. The major obstacles to the health system's readiness for the pandemic were lack of easily available health service, absence of necessary supplies and tools, and constrained testing capacity and surge capacity for COVID-19. It measures that via local, national, international cooperation can strengthen the health system financial stability and resilience. Due to the pandemic or during the pandemic, access to health was difficult because there was lack of health service prior to the COVID-19 pandemic. While this pandemic happened, there was packed need of this health service, which brought the health service into lack, absence, and supply tools were not easily accessible. So access to health was so an issue. There was also lack of advanced healthcare facilities and intensive care units because this COVID-19 pandemic needs oxygen for highly impacted people. So the country had, or the continent had a lack of this intensive care units, which caused more burden on the intensive care units, understaffing and overcrowding in hospitals, crippling healthcare condition in transportation, restricted access to hygienic supply and clean water, ineffective primary healthcare infrastructure, and lack of vaccination training programs and a low vaccination rates are just a few of the medical facility and resources that Africa has to combat the COVID-19 pandemic. The other health issue is the mental health issue. In comparison to other populations, the prevalence of anxiety and depression is significantly higher in the African population. But this is an area for additional research because a lot was not done on this research on the mental health issue. Some reports show that in the comparison to other populations, the prevalence of anxiety and depression is significantly higher in the African population. This mental health issue can arise from the outcome of this pandemic because, as we all know, somebody who is infected by this virus or by this COVID-19 strain of virus was supposed to be brought into quarantine or a unique place for them to see. That causes stigmatization or the feeling of being left out. This causes kind of being scared. So those who had the virus, sometimes they don't tell people that they have it because they're afraid to feel left out. This is another mental issue. And those who recovered from the virus also still feel some type of depression and anxiety. The other health impact is there was health inequality. Studies show that poor health were associated with poverty both before and after COVID-19, with the latter having a value that was 6 times greater than the former. There was health inequality before COVID, but even after COVID, this value or this figure rose 6 times greater than before COVID-19. The health system, it decreased patient flow, which was followed by missing appointments, repurposing of already existing service. Africa's health system were not well prepared for the pandemic, and its effects was severe. Response time were lengthy and out of proportion to the severity of the issue. So somebody with the COVID was taking a long time to be seen in the hospital because there were larger amount of patient flow. It has also raised awareness of the need to reform and rejuvenate the continent's health system. It was a great awakening for the continent and for the country that the health system should be something to be worked on or to be rejuvenated. So in the future, whenever this kind of hard pandemic arises, or any health issue arises in the world, it's needed to rejuvenate the continent's health system to avoid the rate of or the amount of people who are dying or having to be impacted with this COVID-19. So this has raised an awareness in the health system. So the governance impact is the first one is, when we come to the government, like any other government around the world, the Ethiopian government has done its part in announcing lockdowns, announcement of closure of school, the social impact or the social events were banned. Nobody was allowed to have social distancing was a major thing to do. Even people were going to prison for not wearing masks, for not keeping their distance, for being found in this sociable impact environment. The pandemic has shown deficiencies in both government coordination and the use of evidence for policy making, which directly affects the form and the quality of the action implemented to address the crisis. Its aftermath as countries face unprecedented government problems. The governance impact even after the COVID-19, it has made still, it has an after impact or post-COVID impacts. The first impact was on the user participation and engagement. The greatest way to involve young people in decision-making about their health is to spend time cultivating meaningful relationships and making sure they are fairly compensated for their effort. Young people frequently run the risk of both being exposed to COVID-19 and losing their job as a result of the pandemic. Out of any society, the youth is the most to be affected with this pandemic. That's why the youth empowerment is needed. The government's youth empowerment was needed because the youth accounts from 18 or 17 years old to 35 years old, which is a wide range of gap. So, and as we started our presentation, I told you, or I mentioned, like 19% of the population is youth, which can highly affect the life of the young people, because they can be risked for being exposed to COVID-19 because they are mostly the working class, those who are going out and putting themselves to be exposed, and even losing their job as a result of the pandemic affects the young people. They are the working force of any country or any continent. But the one bright spot was that many young people actively participating in providing pandemic help in their areas, even though they are the one to be exposed to COVID-19, the one to lose their job as a result of the pandemic. They are still the one to help ease this pandemic or to help combat this pandemic. So it also opened opportunity for young people to actively participate in providing any kind of help in their areas. Some did inventions, some participated in their social or society by providing food and clothes for those who are not able to have that due to the lockdown, due to the inflation, due to money economic impact that arose with the COVID-19 pandemic. The other is the human rights and civil liberties. Movement was restricted for a length of time as a result of the lockdown laws. This is an international law that was governed by most governments of the world. Movement was restricted for a long time. People were staying at their homes. This is something that we all know. So a defined pattern of reducing public space has been established throughout time. A challenging atmosphere continues, as does the capacity to exercise one's right to free speech. Regulations also had made it more difficult for civil society organizations and human rights activists, especially women, to operate in nations where civic space was already threatened by the pandemic. So this pandemic also impacted people on human rights and civil liberties. The lockdown, the reducing of public or social spaces, this has both the challenge on free speech, on activity, on being on human rights activities. It caused threatening to this part of the society, so civil society organization and human rights activists, especially women, to operate in nations where civic space was already threatened by the pandemic. So the lockdown restricted any kind of movement. So human rights and civil liberties were also an issue. The other was economic policy responses. African manufacturing may be less affected by COVID-19 than the rest of the globe due to the pandemic's comparatively late arrival. The continent's demographics, which are dominated by a youthful age group, the structure of its economy, and the degree of informality in business. So when we came to the economic policy responses, compared to other countries, the manufacturing parts of the continent or the country was affected, but it was less affected compared to the rest of the globe, because first the pandemic comparatively arrived late than any other countries, and also the continent's demographic was also an issue, and also the degree of informality in business is a reason for it to be less affected. And also to support the global response to the coronavirus pandemic, the international financial institutions mobilized a global response packages. So the first one was the African Union, and the African Union COVID-19 response fund was the first one. So this and the second one was African's Development Bank. They were helping in combating or in giving response to the continent. So more than US $230 billion were funded. So more than $10 billion was funded by the Quick Response Facility, and more than $3 billion were donated or funded by Fight COVID-19 social bond, and the largest of its kind. At the time, were established by African Development Bank in April 2020 to address the problem. Additionally, there is the African Union AU COVID-19 Response Fund, which aims to raise funds to strengthen the continental response to COVID-19 by assisting Africa CDC in purchasing diagnostic and other medical supplies in order to be distributed to the continent fairly. So as a conclusion, as Africa being a home to a large amount of youth population, the effect of the pandemic on the health and governance will highly affect the youth empowerment due to their involvement in different sectors. So the youth empowerment is very much needed because most of the population is youth, and most of the population or the youth population is involved in different sectors in highly numbers. So the empowerment of the youth is highly needed in impacting this COVID during the COVID-19 pandemic, and also post-COVID issues that might arise after COVID-19 has left or has been decreased. So empowering the youth in health and governance will benefit society in combating any post-COVID-19 issues a country would face. So this was the health and the governance impact in short form. I hope you all found it insightful. Thank you very much for your time.
Thank you so much for a very excellent presentation and very insightful presentation. I'll now go to Jerome now. Dr. Jerome, over to you.
Okay. Is that okay? You hear me?
It's okay now. Continue, please.
Okay, thank you. My name is Jerome. I'm here in Uganda, the land of Kabaka and President Museveni in Entebbe Airport. I'm presenting on the...
Can you put your slide full screen? Can you make it full screen?
Okay. Okay. I'm presenting on the impact of COVID-19 on the youth, education for the youth on education for the youth in Uganda. My presentation will basically, I want to talk about how COYOQA project is operating in Uganda. Then I want to talk about the overview of education in Uganda. And then I want to look at the school closure and its impact on the youth. And then I want to look at the role of technology in education, in continuing education during COVID-19. And then the role of government and other NGOs in supporting education during the pandemic. And then the impact of COVID-19 on the future education in Uganda. Now, it is true that across the globe, COVID-19 created the largest disruption of education system in history all over. UNESCO estimates more than 1.5 billion children and youth were out of school because of COVID-19. The close of schools and the learning spaces affected almost 94% of the world's student population. Now, as the government of Uganda, it took actions to curb the spread of COVID-19. The WHO had designed a mechanism of handling COVID-19, and each country contextualized the mechanism and came up with possible ways of dealing with COVID-19. Now, the actions that the government of Uganda took resulted, one, the total lockdown of schools and learning institutions stopped. Total lockdown meant that no one is moving from their home, but even the learners and the schools had to stop. And from 31st March, for the next 22 months, no learning institution was opened. Now, during that lockdown, before the lockdown, there were over 15 million learners that were enrolled in education systems by the time of COVID-19 pandemic outbreak. So the schools closures and the lockdown hit hard on the learners and the youth. The outbreak crisis and the drastic measures taken really exacerbated the pre-existing education disparities by reducing the opportunities of many youth to continue with education as we speak now. And we can say while COVID-19 crisis revealed many challenges to the youth in Uganda, it also created some kind of support and new ways of learning, which COVISAF and COYOQA has been studying for the last 3 years. Now, in Uganda, we started the COYOQA project, and the COYOQA project, the aim was to learn and evaluate and monitor how COVID-19 crisis potentially promoted youth agency. We envisioned that during COVID-19, citizens will have to depend on the government, but also we needed to see that young people are upfront in understanding what the government was doing. So how do we promote civic engagement of the youth? And in doing that, COYOQA project was a capacity development program, which was encouraging innovation, strengthening integration of dialogue, and promoting social accountability in Uganda between the government, the suppliers, and the youth. And the youth in Uganda is key because we have a population, if we take the definition of the youth to be 30 years and below by the UN and 35 below by the AU, Uganda has over 78% of its population young people. So it was very interesting to know how the young people are going to react and how they are going to engage in the time of crisis. The good part of the project, it began right at the early days of the outbreak. And it has been ongoing, learning, evaluating, monitoring experiences of social accountability, focusing on learners and the youth. The project has been able to do baseline survey. It has studied impact assessments on COVID-19, and then it has done capacity development, capacity building conferences and workshops among young people, and developed mechanism of empowering them, of them being able to do social accountability through a program called COVISAF. So the COYOQA project really discusses the impact of COVID-19 pandemic on education system of Uganda. Now, when I look at the overview of the Uganda education system, Uganda government recognizes the provision of education as a basic human right. Every individual, irrespective, is entitled, irrespective of gender, age, race, is entitled to equitable and successful completion of education in Uganda. Beyond that, education is also an enabling right with a direct impact on realization of other rights. Educated people are able to observe and also receive, able to enforce their rights. But also, education is considered to be a global common good and the primary driver of progress across all the 17 Sustainable Development Goals as a bedrock for just, equity, and inclusive, peaceful society. So the government of Uganda has taken the education of the youth as a key component for driving social, economic development and transformation. Therefore, the government has been striving to produce free primary education and secondary education for all children or youth in the country. The government's efforts to improve the teaching of mathematics, science, technical and technological education at all levels, skilling learners through vocationalization and curriculum review has been ongoing. And the government has also done an initiative to promote private partnership, where private individuals or groups of people can also provide education at a fee. Therefore, those who need very good education prefer to go to the private schools, but those who can't afford, there is free universal primary education. And I would say this free universal primary education, the last 10 years, we have seen more than 10 million young people going through primary living examination, which was not the case before. So the structure of the education system in Uganda follows at the early stage, we have what we call preschool. And the preschool is basically given by private entities. But then after the preschool, we venture into primary. So primary will begin from primary 1 to primary 7. That is called primary living examination certificate. This cuts across the country, and the government has also provided UPE, universal primary education, for everybody who can access school going age from 6 years. They should be in school, and it's illegal if you don't take your child to school. Then we have UCE, so the UCE, that is the University Certificate of Education, which lasts for 4 years. We call it O-level in Uganda. And the government has also provided what called UCE, Universal Secondary Education. Now, if you finish your primary 7, you can go to UCE, or to O-level, or you can go to crafty education. But when you finish 4 years, you can also advance to advanced level, which is called higher education or college education, or we call it Uganda Advanced Certificate of Education. Now, when you fail to go to, if you don't want to go to higher or higher education, you can still go to technical school to teach primary teachers, they stop at primary senior 4, and also other technical schools can take you up. Then for those who advance to 2 years, these 2 years are very crucial, because after those 2 years, a candidate or a student are able to go to university or to institution to higher learning levels. And these 2 years are also crucial, is that to be a member of parliament or to host a big office in the government of Uganda, you must have USC, you must have universal, you must have Uganda Advanced Certificate of Education. So basically, these 2 years are crucial. And then you have the others who want to go for more education, they go to the university or to polytechnic and then to other institutions. Now, having said that, it is important to know that while that is in place, the education system in Uganda is a struggling education, like many of the developing countries. The government has done tremendous efforts in providing education through UE, UPE, and UCE, but we can also say there's big disparities within the education system. Boys vis-a-vis girls, there are more boys in school than girls. Some girls are married off early. The kids in rural areas don't access good education compared to those in secondary school. So there's a big gap between enrollment. But also we know that there's also big dropouts. We have many of the young people who start P7, they don't sit their last exams. More than half of them don't sit primary leaving examination. And then another half does not exceed to O level. So these disparities were there, and the government has been working hard with the developing partners to promote and bridge that gap of that one. And then we have also seen some 2-3 years back, the government came up with a program of curriculum review, empowering young people with the skills and sports. And this curriculum review looking at reducing the content load to more contact hours of classroom, to produce more talent, more skills, and more activities. These have been ongoing. Now, COVID kicks in. The pandemic disrupted the teaching, the learning, and the well-being of teachers. When we talk about closure of schools, we look at the youth, the learners, we look at the instructors, and we look at the businesses that depend on the schools. So we talk about 732,000 institutions were closed for 2 years, and over 15 million learners stayed home, plus over 548 teachers or instructors stayed home. This is a big number of people that cannot attend or perform their duties. And this resulted into immediate impacts. One was loneliness. We see a number of people, learners, staying at home. Staying at home meant them being isolated, being off the grip of what they do. And if you're a teacher and you're used to sit in class and teach, then you find yourself at home with no plan. The loneliness and isolation was a major problem because young people became isolated. They became anxious about COVID-19, but also they lacked access on information when they are going to begin school again. So every day, nobody knew how long it's going to last. Will it take 3 months, 1 year, 2 years? So this anxiety gave birth to so many things. Some people went into alcoholism, drug abuse, so many things that were happening to young people that even after COVID-19, we are still learning and studying what happened to young people. The other thing, the child labor. One young person said that schools were closed. There were no option than going to the farm to dig. Young people ended up having to toil, make bricks, cook, go to the garden. Some had to become the parents. They were cut off. And then the other part is domestic violence. The social distancing, the quarantine, and the recommendations that were supposed to be made increased economic stress at home, uncertainty, and this increased gender-based violence at home. Kids would see parents fight, parents were fighting, and some of these children, they also stay with the step-parents or stepmothers who were literally mistreating them while they were at home. So the closure of learning institutions hampered the provision of essential services.
Yes.
That there was serious innovations the government and the education partners had to develop mechanism of continuing education. Yes, the institutions were closed, but learning was not stopped. And so we see two things that came up here. One is technological adoption. Institutions were used and increased the use of gadgets like computers and laptops and tablets and phones, and became a new normal for attending class. Instructors now had to replace the normal chalkboard textbook with apps, videos, soft copies, online courses to enhance learning experience. Of course, for some young people, this was not going well from where we have been observing. Some would say, yes, though that was done, but for us, we don't even have electricity. We don't have a computer. However, even while that was done, the government had also made they printed materials, and through the local system, the local government system, they were able to distribute materials to the local person on the ground. However, we can say still it wasn't very effective while that was going on, because some young people could not access the phones, the internet was very weak, electricity, radio. A young person said that I'm looking for money I'm looking for food. I can't buy batteries to listen to the radio. How can I watch TV when I've never even owned a radio? Those are kind of things that were going on. Some areas they can't afford to print. They have no printing services. So that was going on. The other thing that came up to continue education is called the blended learning. The youth had to blend learning to compensate with the losses. Blended learning meant that if I was in a P5 for 2 years, I would go straight to P7. And then I would still cover the things I lost in P5. My children, for example, one was in P3, and when they opened, it was supposed to be going to P5. So what my child is going through, he has to learn the things of P4 and the things of P5 at the same time. So this is blended learning. The student at the higher school, higher education, they were studying the courses they lost during the time of the pandemic alongside the new courses, so that there was no declaration of dead year. The student managed to study. However, this also created a big imbalance according to our study. A number of them could not attend the blended classes. Some of them could not afford the tools to use in the blended classes, and kids, students or youth in remote areas could not even access the blended services to learn in the first place. And yet they all have to sit the same class. So this widened the gaps of inequalities and imbalances in academic system. So what was the role specifically of government and NGO in supporting education in Uganda during the pandemic? Number one, like I was saying, they supported continued learning. Education partners like World Bank, UNICEF, they developed and implemented education sector preparedness and response plan for COVID-19. And in this one, they really crafted ways of responding using online, television, mobile phones, internet, to provide lessons for learners at home. Even those learners that lacked access of technology, like I said, they were able to be given printed materials. Like I said, we're covering some of the stories that we have. A young man said that I am a student in senior 6. My brother was in senior 4. COVID has exposed us a lot. I can't afford the e-learning because they are not required gadgets such as radio, TV, computers, internet. And at some point, the government was providing learning through Mega FM. To some of us, even something like the battery for the radio is not there. My mom's focus was to struggle to get us food, not to buy batteries. So you can see, while the efforts were taking place, many students could not access the continued learning. One participant opposed this and said, not all students can afford digital studies or online studies. The program was aired on local radios and TV, but some of us are remote even to access the frequency. So the logistics of power source for radio, besides teaching people while they are already playing or doing work at home, was not very practical. The other thing that is very key that the government did in Uganda was the policy to continue with pregnancy. Now, the government of Uganda in 2015 had a clear policy that you cannot be in class while you are pregnant. So the government designed a policy against pregnant children attending class. However, by the time COVID-19 ended, so many learners had become pregnant. We are talking over 6,400,000 teenagers had become pregnant. And this meant that there was pressure. So the government put up a policy that even if you're pregnant, even if you have a baby or a child, you are free to attend school. And it was official, it was against the law that if you refuse a child to come to class while babysitting or nursing the baby. Now, this was also a serious challenge. Teachers were not designed, had not learned how to teach a girl while pulling out a breast to feed the baby. Some schools don't have access to medical facilities. So a pregnant girl who is 9 months pregnant, it is hard for them to attend the class and pass exams. So, but all the same, we had the youth voicing things like, we don't have any vocational schools in this area. Government should provide us vocational schools. Government should provide equitable public services across the place for all beneficiaries. So, another person was saying that I am a candidate class waiting to write my Uganda certificate of education, but I can't afford e-learning. What am I going to do? Others were annoyed that they became pregnant and the people who impregnated them left them. So lastly, what would I say is, what's the impact of COVID-19 on the future of education in Uganda? I can categorize the impact in 3 major ways. One, those that concern the students themselves. We see there was increased gender-based violence against learners. There's frustration that led to other alternatives. Some young people gave up education. Some said, I'm overgrown to be in class anymore. There was increased school dropout. There was increased teenage parents and vulnerability. Many young teenagers became parents and were forced into marriage. We see drug addictions. Young people became sexual workers for survival. These were basically young people, and these have been, I mean, it's not over yet to study the kind of impact of closing school for 22 months. The other thing we see is teachers. Teachers were switching roles. Teachers had to learn how to ride bodas, how to make bricks, how to sell vegetables. And some of them discovered they were making more money in making boda or making bricks than teaching. So we see deliberately some teachers have refused to go back to teaching. But also there is widening inequality and regional imbalances. The kids in urban centers who accessed e-learning were far better off than the kids in rural areas who could not access e-learning. But also we see that the kids in urban centers, where they are the one facing police brutality, they lacked food, they were locked in ghettos. So we see that they actually faced a number of problems within the city. Those in the slums had major problems. And then, but at the same time, we see creativity and innovation. We see young people becoming creative. And as I speak now, many teachers are using gadgets. They're using computer. Look at our presentations now. It is the normal. There's a Zoom meeting. You just go for it. I supervise. I'm a teacher also. I supervise most of my students now on Zoom. I don't have to be there. It became normal. People were exposed to learning, but also some kids or some youth discovered that learning in class is not enough. You must get skills. So young people now are no longer afraid to learn how to make a bricks or carpentry or work, because at one point, your education and your papers, you and the teacher and the learners were completely powerless. And those who had the skills were the one surviving. So we see young people now more involved in skill-taking activities. The other impact is on parents. We see some parents gave up on supporting their kids to education because of the biting economic situation in the country. The economy is not doing well, so they can't afford school fees anymore. We see parents abandon their kids who are going to school, forcing them to get married. We see them looking at money as money they wasted, doing classes, and redoing classes is now like wasting money. So parents are abandoning school. We see those who had businesses in school, like those who had school canteen, those who supply food in schools, those who school equipments, the businesses dropped. We see schools closed because the banks took them. We see parents learned to do homeschooling. Now they gave up going back to school. They are doing homeschooling. We see school parents taking their kids away from the normal trend to technical school. All these are new things that are coming up. So what are some of the policies that we should look at in terms of policy? One, in terms of the young people, we know that COVID really increased the inequalities within society. Either youth dropped out of schools or their education was heavily infected. We had a young girl asked us, what next? What about us? And the question of what about us was like, whoever comes here is talking about a girl who became pregnant, but they are like, for me, I didn't become. Everyone from the state actors, from the non-state actors, international actors, focus on child mothers. What about us who have not given birth? What about us who did not conceive? What about us who lost our boyfriends? What about us who did not get pregnant? Should we first become pregnant for government to remember us? What about us who are frustrated with the fact that we can't afford school fees anymore? What about us? The government and its partners must create solutions quickly on skilling young people and empowering them on job creation and attitude change towards vocational training. Now, on the other part of the teachers, the COVID-19 clearly stipulated that we must promote the well-being of teachers, and the teacher security should be given a priority. education in Uganda still rides on teachers. Teachers have a lot of work to do, but teachers have been marginalized. The time came, they have no food. The profession of being a teacher was abused during COVID-19. And there must be promotion of well-being of teachers, to be given food, shelter, health care, and the value of schools, for that matter, for example. That is also important. Schools are not just to teach math and English. Schools provide shelter for vulnerable children. They provide balanced diet for kids. They provide health care. They provide psychosocial support for the for the children. So schools are platforms through which young people are able to air their views and learn better. And the other part, that government therefore should be financing education not only to government-aided schools, but also to private-owned schools, because they are all giving services. At a time when people's schools were being closed, the private companies or individuals were crying for government to bail them out, and the government didn't have money. So some people had to take loans, others the schools were taken. And the kids, imagine if you go back to school and your school was sold. Now it's a piggery farm or a chicken farm. And the other part is about parents. We have to figure out new learning methods, like child-centered learning methods, where kids can learn by themselves. And lastly, institutions should provide psychosocial support to students who suffered gender-based violence during COVID, who became pregnant, who were sexually assaulted or abused, who went through teenage pregnancy. These should be now inbuilt in every school. There's a need to have psychosocial support to young people. I thank you so much. I'm sorry for the disruption of the internet, but this is the new normal and we are learning to live with it. Thank you so much.
Thank you, Dr. Jerome. Thank you so much for your very insightful and interesting presentation. So with that, I will take some questions. So I'll give the floor to Malcolm Sra to facilitate this part of the session. Malcolm Sra, if there is any questions and comments and so on.
Okay, thank you, Alamu. And thank you all the presenters for the very nice presentation, and nice to see you after quite some time. Okay, now we'll go to the question and answer session, and I think Professor Barasa has raised his hand. We'll begin the session with Professor Barasa's issues.
Thank you so much, Malcolm Sra, for inviting me. Colleagues who have presented, Dr. Jerome and young Beth, thank you so much. I'm sorry, I must first turn off my phone. Somebody was calling. Allow me to think this way, and this is to Dr. Jerome. I thought that you took a little too long discussing the education system of Uganda. I thought that could have been condensed a little so that we get into the issues that affect the youth. I know why you're doing that, because you're talking about the impact of COVID on education for the Uganda youth. But I thought you took quite a bit of time. I may be wrong, but that could have been this. I only have this particular question for you, Jerome. I hear a lot about technology, integration of technology to deal with the issues that COVID, the impact of COVID on education. But you also speak in the same breath about 2 years of closure. Now, I would like to understand this a little more. In terms of social accountability, how did the youth hold the government of Uganda accountable to issues such as what you have raised, that some parts of the country could have been learning while others are not learning? Besides the fact that they were affected, the impact, but how did the youth then attempt to mitigate this impact of COVID on themselves within the education sector? I would like to hear something about what, if you found out, what the youth did themselves, try and make the government recognize. And once it recognized, respond in an accountable manner to the issues they were going through. Of course, I heard the voice of the girls who are saying, you're interested in only the pregnant girls. What about us? But what did the youth themselves do to hold their government? I'll stop at that, Melkamsa. Thank you.
Should I answer or I have to wait?
Please, I have a question, Malkamsra. I put up my hand.
Okay, Dr. Tulfina.
I think it is good for us to ask the questions together, and then after that he can respond. Thank you, Jerome, for going deep into this. Now, I have two issues. One of them is the digitalization really helped the whole world, and Uganda included. So, especially the youth, they have even used the digital space to create awareness and also to hold the Ugandan government accountable. I think we were with you when the youth in Masaka were saying how they tweet, how they have been connecting with the other youth in the whole of Uganda to hold the government accountable. The youth in the university, Makerere University, were complaining, and Gulu University were tweeting and complaining about staying at home for 2 years and the impact it has had. So I think this, to answer Prof partly, this digitalization assisted the youth in not only creating awareness, but also forming coalitions to hold the government accountable, even if the government did not answer them back. They used it for social protection. Now, my question is on the civil society organizations and their role in education. We visited several youth-led civil society organizations in various places, and they told us what they were doing. You haven't mentioned anything about that. And it's because the youth in those civil society organizations were the ones who were the voice of the youth in Uganda. For example, in one of the places where we went, Ingabo, we found that it's a skills center where youth meet and they make their hair. The others are carpenters, others are working in the welding, whatever, in the slums of Uganda. Now, they were asking the government to ensure that they have certification for their apprenticeship. You haven't included that in your, and yet this is very important because the youth were advocating. The civil society organizations were agitating the government to ensure that is done. I also would like to take you to Gulu with the work that Mapinduzi is doing there. You have only mentioned about the girl who's asked, what about us? But then how did those youth, when we went there, there was even a function, and the youth, even in the speeches that they made, in the skits that they did, and even the recitation, they were, yeah. So Jerome, respond.
Thank you so much. You've aided my work. Now, in the main paper, the full write-up of the presentation, the voices and what the alternatives the youth came up with are well captured. But just to answer Professor Balaza, we see that COVID-19, I talked about leading to creativity. Talk about creativity, but this creativity is not just in terms of the technology. The one, we start with the teachers. Now, when I say teachers here or instructors, they are also youth. They are young people teaching young people. We see many of them switching roles in their effort to survive. They were trained as teachers. Now, many of them were now running in activities, side businesses, and majority of these, they were salary earners in private schools. And when COVID-19 came, the government schools, the teachers were being paid money, but private schools, they're not paying teachers money. So what happened that many of these teachers had to find ways of survival. And this really impacted what teaching means. And many of these teachers, we call teachers, but they're young people. They had to come up with other alternatives. Some entered politics. Serious young people from education have entered politics. They became counselors, they became agitators for other things. And also they have also sought employment elsewhere to get income. One person said that when the pronouncement was made on 20th March, we thought it would come to pass and life would be normal, but that wasn't the case. So it became difficult for us. And so it has taught us a lesson to rethink the career we choose, the desire since childhood. But again, I want to divert from my colleague. Is reporting about COVID is bad. The other way around, we have benefited from COVID. It's like self-discovery. But I think I was inclined to many activities, teaching in some schools. Now I have changed my career into farming as a business. And then we see a lot of voices of, I was in informal employment. My mother was a grade 3 teacher as well. We both lost jobs. I came back home with some little savings. Now we are using it to access food and to develop business. These are shifts now that happen. But then Dr. Trofenas mentioned Mapenduzi. We had young people we had leaders who developed skilling centers where young people go and learn skills. Now, these young people were not necessarily lower dropouts. Some of them were at the university. Some of them were finalists in the university, some in high school. They all went into the farm. And when they entered the farm, we see that there was providing alternatives. We see the young people saying that I was a student, school closed. We are sent home without any plan for the opening. I lost hope and interest in studies due to peer pressure. I got a baby, which I never planned. Now I'm doing school normal, but I found life at the center, learning skills. Others say our kids were staying at home doing nothing. They eat a lot of food, they have overgrown, they have forgotten anything to do. But now we are sending them to learn skills. So these were voices. But then we see that young people also are agitating. If government can get us involved on hands-on training for the youth and support us to access marketplace, we can do better than going to school again. Others were saying government should provide businesses for young people. Now, the question is, how is social accountability envisioned among young people? who during COVID-19, especially the youth. Now in northern Uganda, we got vigilantes, young people who say you can't cut our wood, charcoal, and they set up patrols to stop cutting trees. These are young people initiatives. We have another saying now, Tubalabise. It's called Tubalabise, is let's expose them. Young people, we studied at the airport, for example, they took pictures of people bribing at the airport, and it became a major issue until the government had to reshuffle all the airport people, because young people, when they first raised some issues, they said, no, those are lies. So what the young people did was to go to the airport every day and expose videos of people taking bribes. Now we went to Kampala slums, the roads. Recently, there was photo exhibitions. Young people were serious, taking photos of the bad roads to expose. The awareness that government has to provide for them has become very strong. But beyond that, during the time of COVID-19, shortly, there was a program called COYOQA. COYOQA was a government initiative to provide funds. And because of COVID-19, it was somehow disrupted. But young people were demanding, because they had received youth initiative money, and now they had received COYOQA. Now there's Polish development model. It is no longer the case where somebody receives government money and disappears. Young people are upfront in demanding for this money and creating accountability towards it. So if COVID-19 has helped Uganda in any way, it has connected young people to know that government has money somewhere and young people must demand for that money. And the same young people entered the politics. They became councillors. They became part of the service providers. And we see this taking place across the country. Young people are becoming young people. The government, when the president is addressing the country these days, he has to say, citizens and abazukulu. He considers young people to be bazukulu, to be grandchildren. And grandchildren to him, those who are 30 years and below, are grandchildren. So anytime the president has to make speech, he has to make sure he addresses abazukulu. And even within the movement system, there is a youth wing that is becoming very strong of late, called MK. And these are all part of it is social accountability at work among young people.
Thank you so much, Jerome. I think you have answered Prof's and Dr. Tufena's questions very well. I hope they're satisfied. We have to end this webinar. We have already overshot our allocated time. Thank you so much, everyone. Dr. Tufena, if you can close the session for us. Thank you.
Thank you very much for attending this webinar. In as much as we have had challenges here with the internet, we shall make sure that we edit it, and what we are going to send out there will be coherent, so that we do not misrepresent you. Thank you very much. We shall meet again. We are going to have similar ones again. We are going to have Kenya now doing maybe on security or on any of the sectors of the economy that we were looking at. We are going to swing them around so that gender. We present.
Didn't you say we were doing gender?
Next time.
Oh, next time.
Yes.
Well, next meeting is security.
Yes. Yes.
We'll discuss about that.
We shall discuss that, Prof.
Okay, sir.
Webinar. So with that, thank you so much for all and also all the participants. Thank you so much. With that, we end our webinar. Thank you. Thank you all.
Thank you.
Thank you. Bye-bye.
Masaginalo.
Masaginalo, Prof. Bye-bye.